More than 100 million Americans are about to have high blood pressure based on new guidelines just released. Joining us now is preventative cardiologist at the Cleveland Clinic, Dr. Haytham Ahmed. Doctor, thanks so much for being here. Let's just put up the numbers for everybody. The old numbers used to be 140 over 90. That was the old standard. The new standard is 130 over 80. Why? Why is this changing?
That's correct, Allison. Just to illustrate this to your viewers, using a brief analogy, your blood vessels are like pipes. They transport oxygen, blood, nutrients all over your body. And if the pressure spikes in that pipe for a minute or a day or a month, nothing bad is going to happen. But over a year, 3 years, 10 years, the pipes just start to corrode faster. And so now trials with over 140,000 patients have shown that reducing the blood pressure under 130 over 80, lower than what we thought before, prevents more heart attacks, prevents more strokes, and prevents death. Okay. And so that's why the guidelines have changed.
That's a good analogy. That is really helpful to understand what's going on there. This means, though, these new guidelines mean that the number of men under 45 years old with high blood pressure will now triple. The number of women under 45 with high blood pressure will double. So, I've heard some people suggest that these new guidelines are sort of just an advertisement or at least assistance for pharmaceuticals, because that means millions more people will have to be on medication of some kind. True or false?
That's not necessarily true. So only about 2% of patients will be recommended to take medications. The overwhelming majority of patients who are now categorized as having too high of a blood pressure will be recommended to make lifestyle modifications. So that's just some natural things that everyone should be doing first as the first line. So there's 4 major things that everyone can do that can really make a big difference.
Okay, such as?
1 is reducing your weight. 2, reducing your sodium or salt intake, keeping that to under 2,500 milligrams per day. Reducing your alcohol intake, because alcohol can really spike the blood pressure. So the recommendations for women are less than 1 drink per day, and for men less than 2. And then exercising regularly. So the American Heart Association recommends half an hour of moderate aerobic activity most days per week. If you just do those 4 things, you can reduce your pressure by up to 10 millimeters of mercury, which will get most people out of the high blood pressure range into the normal category.